Most important chapter in general pathology, cellular responses to stress and toxic insults, or as I like to call it, how do cells survive and how they die trying. If you are studying for step 1, NEET PG or your MBBS profs, listen to me closely. Everything in medicine starts here. Heart failure, that's cellular adaptation. Stroke, that's cell necrosis. Cancer, that's adaptation gone wrong. This chapter covers our NMC competencies PA 2.1 through PA 2.8. I want you to imagine a single cell as a fortified city. The nucleus is the city hall, where all the laws and instructions are made. The mitochondria are the power plants burning fuel to keep the lights on. The plasma membrane is the high city wall with guards at the gates checking who comes in and out. The lysosomes are the waste management and recycling center. Normally, the city is at peace. Everything is balanced. We call this homeostasis. But what happens when the city is attacked? What happens when there is famine? Or the power plants fail? The city has to react, and that is the story of this chapter. We will explore the 3 fates of a stressed cell. Adaptation, the city changes its way of life to survive. Reversible injury, the city gets damaged but can be repaired. Cell death or irreversible injury, the city falls. Let's begin with the threats. What can hurt a cell? The NMC requires us to know the causes. Think of the mnemonic vitamins D. Vascular, hypoxia and ischemia. This is the number 1 cause. Ischemia is lack of blood flow and hypoxia is lack of oxygen. A patient has a heart attack, a coronary artery gets blocked, the heart muscle cells downstream are now ischemic. They are starving for oxygen. This is the most classic example. Infectious, bacteria, viruses, fungi, parasites. Toxic, chemicals, drugs, poison. Alcohol damages liver cells, chemotherapy kills cancer cells and some normal ones. Autoimmune, the body's own army gets confused and attacks its own citizens. Think rheumatoid arthritis or lupus. Metabolic, nutritional imbalances, starvation or obesity, diabetes, high glucose damages vessels, and vitamin deficiencies. Idiopathic or iatrogenic, we don't know the cause or the doctor caused it. Neoplastic, cancer, a rogue faction within the city takes over. Social or physical agents, trauma, extreme heat, extreme cold, or radiation. Developmental or genetic. Sickle cell anemia, Down syndrome, a flaw in the city's blueprints from day 1. When any of these agents attack, the cell must first try to adapt. The city gets stressed, so it changes its operations. This is adaptation. This is a new state of homeostasis. Hypertrophy. The city can't build new buildings, so it makes the existing ones bigger. Let's understand the mechanism. The cell senses mechanical stretch or gets hormonal signals, then activates transcription factors like GATA4, which makes more proteins and mitochondria. In systemic hypertension, the left ventricle pushes against high resistance. The heart muscle cells can't divide, so they get huge. The wall thickens. This is good initially, but eventually that thick, stiff muscle fails. Hyperplasia. The city builds more buildings. This only happens in tissues that can divide, like skin, gut, liver. It does not happen in heart or brain. Growth factors drive stem cells to enter the cell cycle. For example, a pregnant uterus. The smooth muscle undergoes both hypertrophy and hyperplasia to accommodate the baby. Let's take another example of benign prostatic hyperplasia. Older men get growth signals to the prostate, causing too many cells to grow, hence causing urinary obstruction. Atrophy. Let's understand the mechanism. Actually, the cell eats itself. Via ubiquitin proteasome pathway, the proteins are tagged with a trash sticker and shredded by the proteasome. In autophagy, the cell wraps up old organelles like mitochondria in a bag known as autophagosome and fuses it with a lysosome to digest them. The leftover undigested pigment is called lipofuscin. Metaplasia. The city switches its industry. It's a reversible change from one adult cell type to another. Chronic smoker. The delicate ciliated columnar epithelium of the trachea gets burned by smoke. The stem cells reprogram to make squamous epithelium. Why squamous? Because the squamous is the toughest epithelium there is, like skin, so it survives. But there is a trade-off. You lose the cilia and mucus production. You lose the defense mechanism. This is why smokers cough. If the stress continues, metaplasia can progress to dysplasia, which is disordered growth, and then cancer. Okay, adaptation failed. The attack was too sudden or too severe. The city walls are breached. We are now in cell injury, PA 2.1, PA 2.2. How does the city actually break? We look at the molecular level. There are four main mechanisms that interact: mitochondrial damage and ATP depletion, the power failure, mitochondrial damage and leakage, loss of calcium homeostasis, and reactive oxygen species or free radicals. Let's begin with mitochondrial damage and ATP depletion. This is the power failure. This is the most common pathway, usually from hypoxia. There is no oxygen, and that's why mitochondria can't do oxidative phosphorylation and ATP levels crash. What are the consequences of low ATP? The sodium-potassium pump fails. This pump is the city's sump pump, keeping sodium out. Without power, sodium rushes in, water follows the sodium, and the cell swells. This is the earliest sign of injury. Anaerobic glycolysis. The city switches to dirty emergency generators. This produces lactic acid. The cellular pH drops. Acid makes the nuclear DNA clump up, which is known as chromatin condensation. Ribosomes detach. The rough endoplasmic reticulum falls apart. Protein synthesis stops. The city can't repair itself. Mitochondrial damage and leakage. A damaged mitochondrion is a time bomb. If its membrane leaks, cytochrome C escapes into the cytoplasm. This triggers apoptosis. We'll get to that later. Loss of calcium homeostasis. Normally, calcium inside the cell is almost zero. It's locked outside or in the endoplasmic reticulum. In injury, the pumps fail and membranes break. Calcium floods into the cytoplasm, and this intracellular calcium acts like an activation key for enzymes you don't want active. They act like a rampaging mob. The enzymes which are activated are phospholipases. They eat the cell membranes. Proteases, they attack the cytoskeleton and proteins. Endonucleases, they chop up the DNA. And ATPases waste the remaining currency, which are ATP. Reactive oxygen species or free radicals. These are unstable molecules with an unpaired electron. Think of them as sparks that start fires. They attack membranes, lipid peroxidation, misfold proteins, and break DNA. We normally have firefighters, antioxidants like glutathione, vitamins E or C to put them out. In severe injury, the fires overwhelm the firefighters. This is a critical concept, PA 2.2. Is the city just damaged or has it fallen? Reversible injury. The city is flooded and the power is down. Under the microscope, we see cellular swelling. The cell looks pale and turgid. In organs that metabolize fat, like the liver, we see fatty change. Lipid vacuoles pile up because there is no ATP to package them. If we restore blood flow or oxygen now, the pumps turn back on, water is pumped out, and the cell survives. Irreversible injury, the point of no return. How do we know it's over? Robbins identifies two phenomena that signal death: severe mitochondrial dysfunction and profound membrane disturbances. Even if oxygen returns, the power plants are too broken to restart. You see amorphous densities inside them on electron microscopy. Profound membrane disturbances. The city walls have collapsed. There is plasma membrane rupture. The cell contents leak out. Lysosomal membrane rupture. The digestive enzymes leak in and digest the cells. This is called autolysis. How do we diagnose a heart attack or hepatitis clinically? When those cells die, their membranes rupture, intracellular enzymes leak into the blood. We measure troponin for heart damage and ALT or AST for liver damage. The city has fallen. Now, how is the destruction managed? There are two main pathways: necrosis and apoptosis. Necrosis, or accidental cell death, or as I would like to call it, homicide. This is always pathological. The injury was severe, like ischemia. The cell swells and explodes. The guts of the cells spill into the surrounding tissue. The immune system detects this mess and rushes in. Necrosis always triggers inflammation. Under the microscope, the nucleus goes through three stages. Pycnosis, it shrinks and gets dark or ink dot-like. Karyorrhexis, fragments into pieces. Karyolysis, dissolves away completely. We classify necrosis based on its appearance, which tells us the cause or organ involved. Coagulative, the most common, caused by ischemia in all solid organs, heart or kidney, except the brain. The proteins denature and fuse, preserving the cell outline for days. It looks like a ghost town. Liquefactive, the tissue turns into liquid goo. First cause, bacterial infection, abscess. Neutrophils release enzymes that liquefy the tissue into pus. Cause 2, ischemic stroke in the brain. Caseous necrosis, cheese-like. It's friable, white or yellow in appearance, a combination of coagulative and liquefactive. This is hallmark of tuberculosis. Fat necrosis happens in the pancreas or breast. Pancreatic enzymes leak out, digest fat cells, and fatty acids combine with calcium to form chalky white deposits. This process is called saponification. Fibrinoid necrosis, only seen in blood vessels. Immune complexes and fibrin leak into the vessel wall and making it bright pink, seen in malignant hypertension or vasculitis. Sometimes an injured or a stressed cell doesn't die, but it starts hoarding things it can't get rid of. This is intracellular accumulation. You need to study this for your competency PA 2.5. There are 4 main reasons this happens. Normal substance produced too fast or removed too slow. Example, fatty liver. Abnormal endogenous substance piles up. Example, misfolded protein. Lack of an enzyme to break something down. Example, lysosomal storage disease. Indigestible exogenous material gets stuck. Example, carbon dust. Let's look at the major ones. Lipids. This is also known as fatty change or steatosis. What is it? Triglycerides pile up in parenchymal cells. Where does it occur? Most common in the liver, the major fat metabolism center, but also heart. Causes? Alcohol is the number one causes in many places, disrupts lipid metabolism. Other causes are obesity or diabetes, non-alcoholic steatohepatitis, malnutrition, toxins. How does it look like? Liver becomes large, yellow and greasy. Microscopically, clear fat vacuoles push the nucleus to the side. Proteins. Few examples are Russell bodies. Plasma cells making too much immunoglobulin, it piles up in the endoplasmic reticulum. Mallory-Denk bodies. Tangled cytoskeletal proteins in liver cells of alcoholics. Alzheimer's disease. Misfolded neurofibrillary tangles. Next is pigments. Exogenous. Carbon or coal dust. It is usually inhaled. Macrophages in the lung eat it but can't digest it. The lung turns black. This is anthracosis. Tattoos. Pigments sit in dermal macrophages forever. Endogenous. Example is lipofuscin, the wear and tear pigment. Yellow-brown granules. It's just undigested junk from autophagy, a sign of aging or atrophy, not toxic itself. Melanin, the normal black-brown pigment in skin. Hemosiderin, golden yellow to brown pigment. It is a storage form of iron. It appears where there is excess iron or hemorrhage, like a bruise. We use Prussian blue stain to confirm its iron. Another thing that can build up is calcium. Pathologic calcification is when calcium salts deposit in tissues other than bone or teeth. There are two distinct types: dystrophic calcification and metastatic calcification. Let's begin with dystrophic calcification. The calcium deposits are seen in dead or dying tissue. Mechanism is the tissue is damaged. Calcium binds to the phospholipids in dead cell membranes. Serum calcium levels are normal. The patient's metabolism is fine. The tissue is the problem. Examples are calcification in an old TB granuloma, atherosclerosis plaques in arteries, or a damaged heart valve, calcific aortic stenosis in the elderly. Metastatic calcification. The calcium deposits in normal tissues. Mechanism is the patient has hypercalcemia, high calcium in the blood, so it precipitates out. It prefers acidic tissues like the stomach, kidneys and lungs. Serum calcium level here is high. Causes of hypercalcemia is hyperthyroidism, too much PTH hormone pulling calcium from bones. Bone destruction, bone tumors like multiple myeloma, metastasis release calcium. Vitamin D intoxication and renal failure. You can easily learn this by the mnemonic. Finally, we come to the end of the road. Cellular aging. The competency that completes here is PA 2.7. Why do cells eventually fail even without a specific disease? It's a progressive decline in the cell's function and viability. It's not one single cause, but a combination of factors accumulated over a lifetime. DNA damage. A lifetime of exposure to reactive oxygen species, radiation, and toxins causes DNA mutations. The repair mechanisms get slower and make more mistakes. Replicative senescence. the Hayflick limit. Cells have a limited number of divisions. The protective caps at the end of chromosomes. Every time a cell divides, the telomere gets shorter. When the telomere is too short, the cell senses DNA damage and stops dividing, and hence enters senescence. Stem cells and cancer cells express an enzyme called telomerase, which rebuilds telomeres, making them immortal. Defective protein homeostasis. The quality control systems, that is chaperones and proteasomes, fail. Misfolded proteins pile up, gumming up the works. So, aging is a combination of accumulated damage, reduced repair, and the ticking clock of telomeres. So doctors, we have to the life and death of the cell. We saw how it adapts to stress, hypertrophy, hyperplasia, atrophy, and metaplasia. We saw the mechanisms of injury, ATP loss, calcium influx, reactive oxygen species, and membrane damage. We learned how to tell if the damage is reversible or if it has crossed the point of no return. We witnessed the two deaths, the messy necrosis and the tidy apoptosis. We saw what happens when things pile up, accumulations and calcification. And finally, why the cell eventually crumbles with aging. Mastering this chapter is the key to everything that follows. If you understand this, you understand the fundamental language of disease. Reread this chapter in Robbins, look at the histology images. In the next lecture, we will see what happens when necrosis pulls the fire alarm, and we talk about inflammation. I've created a high-yield PDF cheat sheet of all these tables and flowcharts. The link is in the description. Subscribe so you don't miss chapter 3. Good luck studying.